Passion, perseverance, creativity. These words are very familiar to some of us as the fuel and drive for why we do what we do. I believe that these virtues are what enable someone to achieve success in the professional world. If you're passionate about what you're doing, then you will do whatever it takes to learn as much as possible about that field, and if you're persevering in all your endeavors and you never give up, then you won't be put down if an obstacle presents itself to you. And if you're creative, then you can engage problems in creative ways that other people can't, and you'll think outside of the box. I firmly believe that with this combination of passion, perseverance, and creativity, it can make a person a force to be reckoned with. So my quote for the year is, "You can't cross the sea merely by standing and staring at the water," by Rabindranath Tagore. And basically what I think this quote means is, it means that if you don't go after your dreams and you don't really sort of follow through on all your plans, you'll never really get to that point where you want to go. You'll never end up reaching your goals. And so that's, my name is Pranav, and that's a little bit about me. Okay, so in ISM, basically we have informational interviews during the beginning half of the year, and these are some of the interviews I conducted with some pediatricians around Frisco. So my first interview was with Dr. Mi Young Knapp. She's a pediatrician at Best Nest Pediatrics. She went to Texas A&M for her medical school, and she completed her residency at Children's Dallas, which is one of the most prestigious places you can complete your residency. And she gave me advice on things like what to major in during college. She told me about her day-to-day routine. She told me about how like she goes in the morning and like she goes to like hospitals like Baylor, Scott and White, and things like that. And she checks up on like the newborns and things like that. Then she comes into her private practice, and then she helps run the day-to-day operations with other physicians at Best Nest. And so she's also a former ISM mentor, and she is also my mentor for this year. So my next interview is with Dr. Diana. She's a pediatrician at Forest Lane Pediatrics, and it was a bit of a drive, but that hospital is actually really nice, and I really enjoyed going there. She's also a former ISM mentor. She told me about some of the most serious cases that she's seen. She also did her residency at Children's Medical Center Dallas, and the funny thing was she was sort of the chief of the residency program when Dr. Knapp was entering her first year, and so I thought that was kind of interesting. She told me about how her practice is kind of different, and she accepts Medicaid patients, which means her practice is usually really busy because Medicaid patients are people who are on an insurance plan when they can't really afford adequate medical care. So yeah. And then my third interview is with Dr. Kathleen Stokes. She is a pediatrician at Frisco Pediatrics, which is literally like a minute from here. She's basically one of the first pediatricians in Frisco. She's been practicing for I'm not even sure how many exact years, but she's basically one of the first. And so she was just telling me how she's observed the field evolve and change over time. She's saying it's extremely different now than how it was when she started. And she told me about how she kind of doesn't like how there's more government regulation to things, and she doesn't like how nurse practitioners and PAs are sort of being more integrated into medicine, because physicians are being pushed to the side, because PAs and nurse practitioners can do the same job. I mean, not exactly the same job, but they can do many of the same things as physicians, but they do it for their salary is much less. So hospitals and things like that prefer hiring PAs to do jobs that physicians would normally do because they have to pay them less. And she is also a former ISM mentor. And so my other interview was with Dr. Irish Kumar. He's a pediatrician at Lone Star Pediatrics. He told me about the difference between being a foreign grad and a U.S. grad. He told me that nowadays being a foreign grad sort of works against you because a lot of med schools and residency programs nowadays show preference to people who graduated med school and did their undergrad in the U.S. He did his med school in India, so but he also did his residency in the 80s. So he basically did it at a time where it wasn't really as competitive as it is now, but it was still competitive back then. And this one we went more into the medical side of things. He showed me some blood tests that he had sitting on his desk. He explained to me what each of the different levels were, like the hormone levels, the sugar levels, all those things like that. I thought that was really interesting. And he also told me about his day-to-day routine and how he also is one of the physicians that goes around to the hospitals every morning and checks up on the newborns in the NICU. And so my last interview was with Dr. William Perillo. He's a pediatrician at Trinity North Medical Plaza. He gave me advice on majors in colleges. He told me about how he majored in bio at Baylor, but he told me that if he could go back, he would probably major in something else because basically he told me that's the last chance you get to sort of study what you want because for the rest of your life you're going to be basically studying science and biology and medicine and things like that. And so if he said if he could go back, he would have done something like English or writing or something like that because that's what his passion was. Yeah. Okay, and so for my research, basically we have to conduct research assessments throughout the year. And basically what happened was, for my first research assessment, I did an article over codeine. Codeine is a commonly used narcotic that is used to treat severe pain and a cough. A new study has come out showing that codeine over time can be potentially fatal. The study shows that the consumption of codeine can cause a sort of breathing issue in some children, and basically the World Health Organization has removed codeine from its list of essential medications because of this new study that has come out. So I thought that was kind of interesting to learn about. My next assessment was over our field trip to the University of North Texas. This was a field trip that all the ISM students went on, and we got to sort of experience a day in the life of a college student. I got to go and tour the UNT campus for a second time. I did this last year, and I sat in on a developmental psychology course, a pharmacology course, and entry-level biology course. And I actually had a really great time. Those classes that I took this year I found to be a lot more interesting than the ones I took last year. And I really enjoyed the pharmacology course. That was a lot of fun. The professor was very sort of like connected with the class. You don't typically see that in a college environment. It's usually sort of there's more distance between the professor and stuff. So I thought that class was really nice because she was more sort of integrated with the class. And so my next assessment was over SIDS, or sudden infant death syndrome. And basically what this is that it's sort of a condition where it's like infants, they'll sort of pass away for no apparent reason, but they basically what happens is there are certain preventative measures that parents can take against SIDS. And so this new study is basically a new method that parents can sort of do for their child to prevent their child from experiencing this. And basically what it said was that if parents keep their child in their room, in their crib, next to them at night when they're all sleeping, then it drastically reduces the risk of the child passing away. The study was conducted very recently, and another interesting thing was that when I went on a mentor visit, my mentor actually brought this up to a patient she was treating. She was telling them about this study, and I thought that was actually really interesting to see her give that as advice to a patient when I had done a research assessment over that. My next one was over celiac disease. I wanted to learn more about celiac disease because you hear about it so often, about how people can't eat gluten and things like that. Basically what it is that it's an autoimmune disorder where the villi of the small intestine, they lose their ability to handle gluten. Gluten is basically a protein that is found in wheat and food like that, like bread and all types. It's basically in most things. So it's very difficult if you have celiac to sort of have a diet. You have to look for gluten-free, basically everything. Like so many things have gluten in it. So basically, the villi are a part of your small intestine that absorb the nutrients, and basically, if your villi get damaged, then the child basically gets very malnourished, and because their body isn't absorbing those essential nutrients that from their meals. And so over the years, the incidence of celiac disease has increased greatly, and doctors aren't exactly sure why. But nowadays, more and more kids are being diagnosed with celiac. Okay, and so for the next one, I did depression rates rising. Basically, between the years 2005 and 2014, the prevalence of depression has increased from 8.7% to 11.3%. And suicide is now the second leading cause of death between 15 to 19-year-olds. Another thing is that mental health is a huge part of pediatrics. It's not just your physical sort of things. And basically like a lot of the, like on some of my mentor visits, I've seen like kids come in with their parents have had concerns about their mental health, and so I've gotten to see my mentor like do like sort of medical like psychological health evals over those patients, and that was very interesting because I've never seen something like that before. I've only seen sort of physical exams done, so it was really interesting to see the psychological side of things. And for a long time, mental illnesses weren't really treated as actual diseases because people sort of thought they weren't real illnesses per se because there's no sort of physical symptoms to them, but that's extremely inaccurate. Like, I mean, mental illnesses can be as, some of them can be as detrimental as some physical illnesses. And so for my next assessment, I did drug-resistant infections are increasing in U.S. children. So sort of this new strain of bacterium called Pseudomonas aeruginosa is a type of bacterium that is sort of proving itself very difficult to modern antibiotic treatments. It's being able to adapt and evolve, and sort of we learned about this in biology, about how natural selection, how certain bacterium have mutations in them, and those bacterium that have those mutations that allow them to survive antibiotics, they sort of evolve and they reproduce, which creates more like them. So every time an antibiotic is put onto them, the ones that don't have that mutation die off, but the ones that have that mutation and allow them to survive, they live on and they reproduce and they create more and more sort of bacteria like them. Okay, so for my original work, basically what my initial idea for original work, I was going to do something along the lines of like making like an animated video over like teaching like kids like personal hygiene and things like that, like how to wash their hands and like cover their cough and things like that. But it wasn't really sort of like, it would have been more focused on the animation side of things than the medical side of things. So Coach Goff advised me to look into like vaccinations and like, she showed me an article, and that really sort of piqued my interest into this. I found a bunch of articles over it. Basically what happened was there is vaccines in the U.S. the U.S. has the highest amount of vaccines given to a child under the age of 1, but countries like Sweden, Japan, and all of those, they only give around like 5 or 6 vaccines to their kids, and the infant mortality rates between the U.S. and those countries is drastically different. So if you look here, you can see the top 17 countries for infant mortality rates. The U.S. isn't even on there. The U.S. is number 34. So all of these countries, like Singapore is number 1, and so basically like the amount of vaccines they give to their kids is significantly less than the U.S. So the U.S. gives like 21 or something like that by the time they're 1. So people think that there might be a correlation between the amount of vaccines that they're giving to children and the infant mortality rates. So for research and development, I found basically like I went and I looked at basically every article that had been done over this. The main concern is that countries that require less vaccines have a lower infant mortality rate. And so I wrote my paper over how there could be sort of a biochemical relationship between the vaccines that are being given to the children and the IMR, which is infant mortality rate. I learned about the type of vaccines, how they work, and what kind of vaccines are required in other countries. And so the purpose of this was to inform people about the potential adverse effects of vaccines. The medical community as a whole basically accepts them, and they don't really see any point in them. Their vaccines are basically like the go-to thing, like every time a child is born. And they have an extremely high success rate. I'm not saying that there's anything wrong with them. It's just that there might be some potential side effects to them that they haven't really looked into the full scope of. Okay, so for my mentor experiences, so like I said, my mentor for this year is Dr. Mi Young Knapp at Best Nest Pediatrics. So far, I've only gone on 2 mentor visits, but they have been so much fun. Like I get to go like during my ISM period, and I get to go and she sees about like 3 or so patients every time I'm there. So basically, like I get to see her do like sick visits on babies and like checkups and things like that. And so like I got to see one baby who came in. She had like a cold, she had like a runny nose, and she was really congested and things like that. And just like I really am enjoying pediatrics. Like I didn't expect to enjoy it this much, but I actually like it a lot. Basically, I really love the environment of it between I get along pretty well with kids. And so I always thought that I would end up doing something in pediatrics, but I never really knew, I never really sort of knew it until I like started observing it, if that makes sense. Yeah, so it's really shown me what life is like to be a pediatrician, and yeah, I really enjoyed the lifestyle of it a lot. And so I've come to realize that my path to being a doctor is fueled by passion, perseverance, and creativity. Thank you. Oh, that was so bad.